process, and welcome to our webinar about the Ohio budget process and public dollars flowing through the state. We are excited to have you join us. My name is Becky Watts. I am Government Affairs Director with G2G Consulting, and I will be moderating our discussion today along with my colleague, Andrea Harless. I have been working in the government relations field for over 20 years and have had the privilege of working with many organizations as they've navigated government budget processes. I'm based in Cleveland now, but previously spent about a decade in DC and several years before that in Columbus at the State House. And just a bit of housekeeping to note, we are recording the webinar, as you just heard, and our program will be available on our website in a few days' time after we get it loaded there. So we've all been focused very much in the last week or so on the big sports week for Ohio. We were sad, of course, last night. Would have been great to win, but the future looks bright for the Bengals and Joe Burrow. We're very excited about that. And of course, this weekend in Cleveland, we are welcoming the NBA All-Star Game for the first time in 25 years. So very exciting stuff going on in our state. But meanwhile, some other exciting things are going on in our world of government. The state budget process moves along behind the scenes, and we are thrilled to be joined today by two experts in this field of state budgeting and navigating the budget process as an advocate. Before I introduce our panelists, I would like to turn the screen over, as it were, to my colleague Andrea, who's based in G2G's Columbus office, to share with us just some high-level overview of what's happening in and around Columbus to set the stage for our discussion. So, Andrea.
Thanks, Becky. As Becky said, I lead G2G's office in Columbus. My background is in state government, so I worked in the state senate for a number of years, and I also worked at Franklin County Public Health here in Columbus before I joined G2G a little over 4 years ago now. So to set the stage a little bit for our discussion today, I think that most people are pretty aware the biggest thing going on in Ohio right now is redistricting. I think if you've seen any news headline in the past couple of months, you know that's what it's all about. At this point, the Ohio Supreme Court has thrown out two separate sets of maps for the Ohio State House, or for the Ohio House and the Ohio Senate. The Ohio Redistricting Committee did the maps for that, and those were thrown out by the Supreme Court for favoring the Republican Party. They've asked the Redistricting Committee to try again. That decision came last week, so sometime this week, I think we will end up seeing new maps, the third set of maps for the Ohio General Assembly. The maps for the congressional districts have also been thrown out by the Supreme Court, also drawn by the Ohio Redistricting Committee. There was an attempt to have the maps be drawn by the legislature. However, they couldn't get votes from the Democratic Party in order to make that happen. So it's back to the Redistricting Committee to draw those maps. As many of you know, we are losing a congressional seat this year after the census because our population has dropped. So our congressional seats are likely going to look pretty different going into this next cycle. There was a little bit of concern from some of the legislators who are coming back in to run again, or new folks who are running for the first time, about where do I collect my signatures from if I don't even know where my district is. So there has been a little bit of leeway given there, where they could collect signatures from maybe someone that wouldn't be in their district, in their new district, I should say, and still qualify for the ballot. So stay tuned. I think this will be an exciting week for maps, if maps are exciting for you, I guess. The other thing, and more importantly, what we'll be talking about today is the capital budget. The capital budget is a budget that is usually done in the even numbered years. And there's a pot of that funding for community projects, which is, mostly I think what people on this webinar are going to be concerned about. Typically at this point, the bill would be almost done, but we've had to push that a little bit to do a capital reappropriations bill because some of the funding got pushed because of COVID in 2020, of course. So reappropriating some funding that may have been missed from the last cycle, and we are getting ready to really get into the capital budget for this year. So a lot of the legislators have set a deadline of March 18th to get your forms in of what you might be requesting in the capital budget. And I know that our panelists will talk a little bit about, what would qualify for that. But if you're considering capital budget funding, now's the time to be doing those meetings, and you could not be joined by better folks to tell you about what exactly that is. So I will hand it back to Becky. Oh, before I do that, I should say we are going to take questions from anyone that's on at the end. So please just feel free to drop them in the chat and we will pick those up at the end.
Thanks, Andrea. It is now my pleasure to introduce our panelists. We are joined today by Kim Murnieks, Director of Ohio's Office of Budget and Management, and Will Tarter, Fellow for the Center for Community Solutions. Director Murnieks was appointed Director of the Office of Budget and Management by Governor Mike DeWine in January 2019, serving as the Chief Financial Officer under the leadership of Governor DeWine. She oversees an office that develops, coordinates, and monitors the individual budgets of state agencies, provides the governor and administration with policy analysis, and reviews all financial transactions made with public funds. Director Murnieks, we're very excited to have you here today. Additionally, we have Will Tarter, Jr., who serves as a fellow for the Center for Community Solutions. And he can, I'm sure, will tell us more about what that organization focuses on. Before joining Community Solutions, he worked in both state government and for nonprofit organizations, including the Ohio Secretary of State's office, One Community, the Downtown Cleveland Alliance. He participated in the legislative fellowship program in Columbus at the State House, and has served on the Cuyahoga County Charter Review Commission. So, well, thank you so much for joining us today to share your perspective on all things state budget. So to kick us off, I will turn it over to Director Murnieks to share with us some opening remarks. Director Murnieks, thank you.
All right. Well, thank you, Becky. It is great to be here with you on Valentine's Day to talk about the subject I love the most, the state budget. So thanks for the invitation and looking forward to a great discussion. So as Andrea and Becky mentioned, we are in the capital planning cycle now. As I'm sure you all know, Ohio has a 2-year budget, biennial budget, and in the odd numbered years, we do the biennial operating budget, which is then in place for 2 years. And in the even number years, we do the capital budget. So unlike the operating budget, which is crucial to be passed every 2 years for the ongoing operations of the state and the provision of services, the capital budget is, I'll call it more optional. It is to fund the ongoing capital facilities of the state, but it isn't crucial that it happen for ongoing services. So sometimes the capital budget can be on a different cycle than kind of that July 1st cycle that we're so keyed in on with the operating budget. So this spring, we Andrea mentioned the reappropriations. We are gearing up to work with the General Assembly to do the reappropriations bill. That is the bill that extends already approved capital appropriations. If an organization or an agency received a capital appropriation in the last capital budget, which passed in December of 2020, but has not had the opportunity to fully expend those capital dollars, again, because capital is facilities and buildings, things that take longer to really gear up and plan and then spend. So each year we do, or each capital year, we do a reappropriations bill that continues the unspent capital funding. So if you have a community project or an appropriation that was in the most recent capital budget, but that has not yet been expended, it will be extended during this reappropriations process. The new capital budget then will very likely be a separate capital budget bill from reappropriations. Sometimes they're the same bill. At this point, we're looking at these being two separate bills. So that will come later in the late spring, early summer timeframe, most likely. But again, it's not set to a specific time schedule like that operating budget is. So as many of you will remember, the last capital budget actually was enacted in December, as opposed to in the spring or summer. So that is kind of big picture what we are working on. And so I have been working with all of the state agencies to plan for the state's facilities needs. And we're engaging with the General Assembly on that community projects piece of the capital budget. So a couple things to remember as you're thinking about requesting a community project, a few keys. First of all, the capital budget is not funded by state general revenue funds. So what that means is unlike the operating budget, where there's a lot of flexibility around the uses and purposes, the state bond funded capital appropriations have certain rules, and those are set by all of the bond related rules, some of which are federally kind of driven by the federal government, and rules and regulations around the securities markets. So the municipal bonds that fund our capital have a variety of purposes that are set out in the state constitution. So again, there are just a lot of kind of things to keep in mind as you're thinking about what might be fundable with a capital appropriation. And to one of the things I recommend as if someone is looking at, okay, I have something that is kind of a permanent facility that I need to have renovated or built, and I would like to use state capital funds. First of all, think about what is the state nexus? What is the purpose that it can be linked to the state's purposes for again, that to make sure that it can be bond funded. So it can't just be a general public purpose. It really does have to somehow align to the state, whether that's the state from a natural resources perspective, like parks or nature preserves, or a state college or university from an educational standpoint, or a cultural facility. That's where we can fund things like local projects like museums and memorials and kind of those types of theaters and opera houses that you see receive funding in the capital budget. So again, it has to have a nexus to one of those specific funds and purposes. And we do have, if you go to the OBM website and click on the budget and planning and then the capital budget section, there is a community projects kind of cheat sheet that you can look at to see, okay, what are the different bond funds? What are things that are fundable from each of those bond funds? And then on page 2 is a list of all of the things that aren't able to be funded with capital funds. So you can kind of get a sense of, okay, I fit into this category, or well, I'm on page 2 and that means I can't be funded with the capital budget. So I may want to think about starting to plan for the next state operating budget cycle, which, by the way, agencies will start planning for the next 2-year operating budget cycle just a few months from now, this summer and early fall. So it's never too early to start thinking about the operating budget cycle too. So back to capital budgets, bond funding. Again, it's just so key to keep in mind that this is not regular general revenue fund. And so you need to really to think through, what is my project? What is that link to the state? What is the particular provision that qualifies under one of the state bond funds? And then most importantly, how do I communicate with the decision makers? And I always recommend that when folks are thinking about a capital budget project, that it's really important to be kind of on the list for both the House and the Senate. And I also recommend talking with the governor's regional rep too, because if you have a project and when it gets time for us to kind of sit down and go through all of the capital requests from all of the legislators, if you have kind of made your case to all three parties, and we all are aware of your request, why it's important to Ohio, why it's important to the local community, and especially how it might be beneficial to the local community and economy. If you've made that case and you're on all three of the lists, you have that much better of a shot of actually getting through the process. Because as you can imagine, the list of requests is voluminous. And so again, it's just really important that you do that work up front to make your case and talk to all three of the important decision-making parties. So that's big picture, I guess, capital budgeting in a nutshell. It is what can be the most fun part of budgeting, because we do get to really talk about all of the pieces of our communities and the things that really make Ohio an amazing place, all of our cultural assets. And so in that way, it's I guess a really fun part of the budgeting process, but it also is pretty complicated, because making sure that a project can be bond funded is often quite complex, and it can be tricky and what we don't ever want to happen, but sometimes does happen, is something gets appropriated in a bond fund in the capital budget. But then when we get to the point of actually working with the agency that is the fiscal agent for that project, and we find out more information and it doesn't qualify on the back end. And so we hate for that to ever happen. So we want to make sure everyone is kind of doing their homework and due diligence on the front end at the beginning of the process. So that is kind of where we are with the capital budget. Again, we're kind of early in the process. It's that planning time, getting geared up for it right now. I know we're also maybe going to take a little bit of time today to talk about the American Rescue Plan Act. You've probably heard of the federal funds that are available to the state through the ARPA bill that was passed by Congress last spring. So far, the state has appropriated most of the first tranche of funding, but there will be a second tranche of ARPA funding coming later this late spring or early summer. And so that will be, I guess, another budgeting process that we'll be working through with the General Assembly as well. And again, those are COVID recovery dollars with specific federal rules tied to them. So Becky, I'll send it back to you, and happy to answer questions at the end.
Thank you so much, Director Murnieks. Really helpful overview of that process and capital budget and everything that organizations should be considering at this time if they plan to apply through the legislature and the administration. And I know it takes up a lot of time of our legislators and agency staff to review all these individual community project requests. So appreciate the opportunity to hear directly from you on how to hopefully improve our requests at the outset. So to that end, I would like to now turn it over to Will, who's kind of on the other side. I don't know that you're necessarily asking for a particular capital budget request, Will, but but I know you advise organizations and work with a lot of folks who are interested in this, and look at and Director Murnieks mentioned the operating budget as well, and that your organization does a lot of advocacy around that process too. So thank you so much for joining us, Will, and I will turn it over to you now.
Great, thank you, Becky, and thank you to G2G for the invitation to be a part of today's panel. And it's a privilege to be on the same panel as Director Murnieks. So thank you so much for the opportunity to be here. I'm going to go ahead and share my screen as we begin the presentation. All right, hopefully everyone can see everything okay. So again, my name is Will Tarter Jr., and I'm a fellow of Public Policy and External Affairs at the Center for Community Solutions. We are a nonpartisan public policy think tank based in downtown Cleveland. I'm going to try and advance the slides. Here we go. All right, so this is my about me, but we already went through that. So as I said, I'm a fellow at CCS. We're a nonpartisan nonprofit public policy think tank located in downtown Cleveland. We do also have an office presence in Columbus. Our organization focuses on public policy and health and services. One of the things that we are most known for are our community fact sheets. We act as a resource for information for elected officials, organizational leaders, and members of the general public to find out what's going on in their communities and share that information with elected officials and decision makers, as well as a liaison to share information of what's going on in the policy landscape in Columbus and in other places that would impact organizations that are serving the public in health and human services. We are a research, analysis, and advocacy organization. And as I said, we try and connect people. If it involves health and human services, we're typically involved in those conversations. We're really thankful to be a part of today's conversation because we do deal extensively in the budget. And most recently, this past state budget directly impacted health and human services in several ways. But we also find ourselves in an unprecedented time in the middle of a global pandemic. And so trying to respond to the health and human service needs of Ohioans was really, really important. And I am going to share some of the outcomes of the budget with you today. And then also we're going to conclude with some recommendations in terms of advocacy as you engage with elected officials during the budget processes. This is just to give you an example of our community fact sheets. So no matter where you are in Ohio as you're listening to today's presentation, I would encourage you to go to communitysolutions.com/resources and click on community fact sheets. Here you'll see fact sheets for every state house district in Ohio, every state senate district in Ohio, every congressional district in Ohio, also all 88 counties. You can see information on demographics, household income, poverty, insurance coverage, among other health indicators. And people are free to use this information to inform the arguments that they're making on the services that they provide to the community. So I'd encourage you, please check that out at your convenience. At Community Solutions, we have 5 service areas: advancing the well-being of older adults, enhancing behavioral health access, improving infant and maternal health, strengthening the health and human services safety net, and supporting sound Medicaid policy. In today's presentation, I'm going to briefly touch on some aspects of the state budget that were included in these areas of study. But I would also encourage you, what I want to do is send links to our blog post on the state budgeting matters that we published a few months ago, and Becky will share that with the group after today's presentation. All right, so those areas we're going to touch on are aging, infant maternal health, harm reduction, crisis services, Medicaid, food banks, and advocacy. We'll close out with advocacy. All right, so before the pandemic, the issue of aging is something that we have to wrestle with as a state. We are an aging state and an aging country. And so how do we respond to the needs of older adults? And this was, as I said, an issue before the pandemic, but the pandemic really elevated visibility of a lot of the needs of our older adults and how we reach them in terms of transportation, mental health, and food insecurity, among other issues. And so Department of Aging works very closely with the regionally federal agencies, the area agencies on aging. There are 12 across the state of Ohio. In this most recent budget, the State Community Services Block Grant, which helps to fund programs in the community that benefit older adults, we were pleased to see that was increased to the funding levels before COVID and the cuts that took place a couple of years ago, but there was also an additional $1 million that was added in the conference committee. So we were very happy to see that. We were also pleased to see an increase in the adult protective services line. So for those who may not be familiar, adult protective services provides support for older adults if they're facing emotional, physical, or mental abuse. APS funding up to $5.7 million means that you can have at least one full-time employee in all 88 counties, which is really encouraging to see. The Department of Aging also released the State Action Plan on Aging, or SAPA. And so I would encourage you at your earliest convenience to go to the SAPA on the Department of Aging website, because it's very informative in terms of helping to outline some of the steps the state needs to take as the state continues to age, though the funding and execution of the SAPA is still unclear. And here I included a link to our blog post, which goes into more explanation of changes to the Department of Aging in this most recent budget. For infant and maternal health, this is something that is covered extensively by my colleague Hope Lane and Natasha Taki-Mika. Medicaid coverage was extended for women beyond 60 days to up to 1 year after they give birth. And this is something that is huge when we're talking about infant maternal health. This is something that $15 million in all funds and a $4 million state share for each fiscal year. So this was great news. And how will this impact Ohioans? While approximately 70,000 births a year are covered under Medicaid, the Ohio Department of Medicaid estimates that this enhanced coverage will benefit roughly 14,000 Ohioans who would not receive coverage beyond 60 days based on their income. And I would encourage you to check out the blog post related to this subject on Community Solutions website. Harm reduction. The opioid epidemic was something, again, that was an issue in our state even before the pandemic, but also during the pandemic was a dual crisis as well. And so there was funding that was included in the Ohio Department of Mental Health that would aid in increasing access to naloxone and reversing overdoses and supporting fentanyl education campaigns to raise awareness about the threat of fentanyl. So we were very pleased to see this in this most recent budget. In crisis services, the Ohio Mental Health and Addiction Services saw an increase in funding for crisis services across all ages. And this is something that, again, when we're talking about substance use disorders, this is something that impacts Ohioans of all ages. We were very pleased to see a dedicated effort of $2.5 million in this budget that would expand the services. Community Solutions has also long been an advocate for what we call MultiSystem Youth Action Plan. This is youth that are interact with government in a variety of different organizations. It's important to get those organizations working together because there are complex health needs that these children have. And you want to make sure that they get the support that they need. And so we were very happy to see the budget dedicate $5.5 million to enhance collaboration to address the needs of these multi-system youth. I would encourage you to check out the blog post that was published by the Director of Public Policy, Tara Britton, who explores this topic more in depth on our website. And perhaps the most significant shift in policy was in Medicaid. Ohio moved forward with procurement of new managed care plans. This procurement not only included contracts for general benefit administration, but also the creation of fiscal intermediary, a single pharmacy benefit manager, and a new insurance plan for the medical complex children called Ohio Rise, which I just alluded to earlier. In total, these reforms saved Ohio Medicaid over $416 million through the simplification and reduction of duplicative services by the plans. And this is something that I would encourage you on our website to please visit work that has been published by my colleague, Lauren Anthis, who is our senior fellow of Medicaid. Both he and Natasha both published articles that explore changes in this most recent budget in the Medicaid program. There was also an increase in Medicaid reimbursement for the next 2 years for assisted living facilities. We talked about the aging trends that we're going to see in Ohio, and to see an increase in support for assisted living was good news because this is the first increase that there has been in the past 10 years. Food insecurity was also a big issue even before the pandemic. And I think with the onset of the pandemic, we saw an increase in need, an increase of support for our food banks across the state. And we were very pleased to see increases in the food banks line item of $12 million for 2022. We also saw increases in the food assistance program line item as well for both 2022 and 2023. We're very encouraged by that. And then finally, no matter if you're engaging in the state budget or the capital budget, or really any other conversations with lawmakers, relationships matter. Relationships are extremely, extremely important. When people are elected to office, reaching out to them, introducing yourself or your organization, the work that you do, the constituents that are impacted by the work that you do in their districts is really important. And that's something that is important, not just to establish those relationships during the budget season, but even before then, and maintaining those relationships even after the budget season. So there's a lot of people, as the director said, who are reaching out during the budget process. And so you want to make sure that you're engaging on a year-round basis so that you establish and maintain and nurture those relationships moving forward. My colleagues, Kelsey Bergfeld and Sarah Hudacek, did a great job in our Advocates for Ohio's Future in maintaining relationships with elected officials throughout the budget process, constantly educating them on how policy has outcomes on Ohioans' health. I really want to salute them for the work that they did, because the final outcome of the budget really was a testament to the work of advocates in informing the state budget process. When you are engaging with elected officials and you're educating them about the work that you do, and it's really important to talk about, as the director said, benefits to the public and to the community, and things that cut across political ideologies. We're talking about some of these changes in health and services. Not only is there a public health benefit, which is really incalculable, but there also are methods of calculating the cost savings to the state. And these are something that you can reach people from across the political spectrum as you educate and engage them in these budgetary conversations. And one thing that I really like to highlight is share your vision. No one knows your story better than you. And so if you get a chance, share what you would love to see. If you ever read the book, 7 Habits of Highly Effective People, one of those habits is begin with the end in mind. So what is it that you want to see? Plant that flag, work your way backwards. What steps need to be taken in order to make your vision a reality? So this is a very high level view of what happened in this most recent state budget. But at Community Solutions, we are monitoring the budget processes both at the state level and also legislation at the federal level, including the American Rescue Plan Act, which we'll get to in a little bit, because this is something that is so important to Ohioans, the collective public health. But I think because of the pandemic, it has really exacerbated how important it is to make sure that Ohioans have the support that they need, and that would lead to improvement in community health. So again, I want to thank you for the opportunity. This is my email address if you have any questions, and I'll provide links for all the documents that were in this PowerPoint presentation. I'll provide to Becky after the program. Thank you so much.
Thank you so much, Will. Super comprehensive overview. Appreciate that, of some of the provisions of the last state budget, last state operating budget. And I think really helpful as we're thinking about the upcoming sort of beginning of advocacy for the next state operating budget, which Dr. Murnieks mentioned is right around the corner here, for advocates to to start engaging on if they haven't already. And I think some of the principles you just described there in terms of advocacy and knowing your vision can be applied, like you said, across the spectrum, whether it's capital budget, state operating budget, even these American Rescue Plan Act dollars that are flowing through Ohio that you both mentioned. And I guess a first question I'd love to ask Dr. Murnieks is, you touched upon a little bit in your opening remarks about the status of those in the first tranche of funding that's coming through the state from ARPA has been largely appropriated. What would you say, I guess, in terms of folks on this call who are engaged in the advocacy or want to start getting engaged perhaps more in the second tranche? what should they be doing at this point to plan for that? How best to advocate? Can you share any more detail about the state of play for that funding?
Sure. As I mentioned in the opening, most of the first tranche has been appropriated for specific purposes, about 80% of that initial tranche. So as we look forward to the next tranche of funding, a couple of key things to keep in mind. First, the funds, whereas the CARES Act dollars that were enacted in the kind of at the very onset of the pandemic were intended for immediate response kind of to the pandemic and the effects that were happening right then. The American Rescue Plan Act, state and local relief dollars really have a more long-term view. They have a longer spend time frame. They can be spent, they can be obligated through 2024, the end December of 2024, and then spent down through 2026. So they have a long time window. And when you read the federal guidance, you really do get that sense of it's intended for things where you can spend one-time dollars to really make a lasting effect on the community and kind of the economic and post-COVID recovery. It's also important to keep in mind that they are COVID recovery dollars. So looking at the kind of the framework, the tests, is it related to the pandemic or the economic effects of the pandemic? And then how can I spend it one time? Because what we don't want to happen, what we're being very careful to avoid, but both when we were planning the CARES Act and now these ARPA dollars, we don't want to create new programs with one-time dollars that then have an ongoing cost beyond when those federal dollars. So if you look at what the state has already appropriated some of the ARPA funding dollars on, things like sewer and water infrastructure, those are specifically allowable by the statute passed by Congress. And again, they're one-time costs that have lasting benefits to communities. Law enforcement training and response to community violence. Again, kind of things where we can make investments now that should have lasting effects on the safety in our communities, and infrastructure for our children's behavioral health hospitals. That was another large tranche of ARPA appropriations that, again, one-time funding that will have lasting effects. So those, as you're thinking about ARPA, and if you have a priority that you would that you want to bring forth and propose for those dollars, I think it's just important to keep those keys in mind. How does it, first of all, link to the pandemic and the recovery? What kind of planning window do I have? And then how do I make the case that it's not setting up a future, where we have to supplement it with general revenue fund dollars down the line? We don't want to create any kind of budget cliffs with these funds.
Thank you so much, Director Murnieks. That's super helpful to understand. And I know, Will, that in some communities there has been the creation of councils or other sort of oversight entities for tracking the ARPA dollars, and particularly here in community or in Cuyahoga County in Cleveland, that your organization has set up a council for this oversight. Can you share with us how that's working, or what, how an organization might interact with you all to understand better how they can access funding, or is that the role of your council?
Sure. Thank you so much. And Director Murnieks did a fantastic job of the overview of the ARPA dollars. And it was really interesting to me also to see broadband being included in the guidance too. We were really encouraged to see that, because that was something that we saw during the pandemic affected older adults, because many of them were at home. affected children as they were in school. So access to high-speed internet was also something that was very encouraging to see included in ARPA. And one of the things that's interesting to us is the data reporting component of the American Rescue Plan Act and how important that is for communities to report how those dollars are impacting the community. And the director mentioned that in her remarks, and I really just want to emphasize that the data reporting and the outcomes is a really important part of the American Rescue Plan Act allocations. And so to that end, the Center for Community Solutions received a substantial grant from the Gunn Foundation and others to establish the Greater Cleveland American Rescue Plan Act Council, or the Greater Cleveland ARPA Council. This is spearheaded by the director, who is Kate Warren. She is my colleague at Community Solutions. And the purpose of this council is to bring together organizations, public, nonprofit, academic, to inform the conversations about how these dollars are going to be spent that would maximize the impact on the community. And so the ARPA Council is going to be a place that people can regularly gather to discuss how the dollars are currently being spent, what dollars are remaining, because as the director said, these are dollars that have a window of when they need to be earmarked, but it's also not immediate. So communities can take their time in terms of how they are choosing to expend these dollars. And that's why we want to make sure that we have a great chorus around the table that can inform those conversations. And I think what's interesting to me is that you kind of see two schools of thought. You have one that says there is a need right now to get these dollars out the door to address the urgent needs of the community. And there's others who are saying, we have time to get these dollars out the door. Let's be methodical and deliberate on how we go about getting these dollars out the door. So that's where I think community engagement with organizational stakeholders in the community is going to be really, really important, so that you have those various types of perspectives on how you choose to get these dollars spent.
Thank you, Will. Turning back to the capital budget discussion, some questions that have come up. Obviously, the community project funds become a large focus for communities. What is your, Director Murnieks, what is your high level expectation in terms of community project priorities for the administration? Do you have a sense on how much will be allotted within the capital budget for community projects? And finally, three-part question, what percentage, how much should organizations be asking for in terms of percentage of a total project?
Sure. Good question. So I'll start with the how much first. The community projects bucket in the capital budget is optional, and there have been capital budgets that did not include community projects at all. And that typically happens when there is, limited funding, when the budget situation is maybe tenuous. At this point in time, given the state's very strong fiscal position, I expect there to be a community projects bucket. And again, we're having those initial discussions now about the total capital bill size, and none of that is decided at this point in time. But I do expect there to be an opportunity for community projects to be funded. In the most recent capital budgets where there was community project funding, it's typically around $150 million statewide. And I would expect it to fall somewhere, in that general range. But again, that's the statewide total across a variety of both local jurisdictions and purposes. So things to keep in mind, I think, again, having the information about why the project is crucial for the community, the ongoing culture, the development of the community's kind of general economic ecosystem, things that are assets and that we want to preserve, protect. Those are often key. Quality of life issues, having a good community and quality of life is key to creating that, again, that economic ecosystem for growth. And so I think that's important to keep in mind. Community projects funded in the capital budget, again, they're things that are permanent. They're not program specific, but they're facilities, they're buildings, fixed assets. So if you think about how does this asset that I either want to renovate or improve or build, construct, how is that an asset to my overall community's livelihood and growth? And how can I measure that? If it's an existing asset that I want to improve or renovate, how can I show the benefit of making sure that continues into the future? Or if it's new, what do I expect that to be? Or can I look to another community as an example and kind of learn from that? So it really depends on what type of project, but making those linkages to the overall ecosystem of your community, your city, village, county is so critically important. How much it, the bond funds do have caps, and it's most typically we cannot fund more than about a third of any project with state capital funds. Some have different caps, so it does depend on what you're looking at, but you do, if you have a project and the overall scope of the cost, you do need to be able to make that case for how you're going to come up with the rest of the funding, because the state's portion can never be the majority or the only funding. So making sure that you have local funding or a way to come up with that community match, whether that's from an organization or fundraising or another public budget. It cannot be a majority state funded capital request.
That is extremely helpful. Thank you so much, Director Murnieks. Given that we are about 10 minutes to the end of this session, I want to turn it over to Andrea to share with us some of the questions that have come in from our participants and see if we can answer any of those.
Thank you. We do have a couple of questions that came in, and I think probably each of you could have an answer to this. So the question is, we have a project that is occurring in 3 different communities, and they are trying to decide if one bigger request or 3 smaller requests make sense. So the 3 different locations span and are in different districts as well. So what are the thoughts of a good approach for a project like that?
I'll take a first shot at it. I would say maybe both, right? So as you're making your case, talk about the overall scope of the project, but as you're talking to individual legislators and decision makers, I think focus on the specific benefits to their community. And I don't know what the project is, but also think I would want to start by thinking through, what if one portion gets funded and the other 2 pieces don't, or what if 2 out of the 3? So is it something that can be split? Could it be split over multiple capital budget cycles? Or how can I use the fact that it does span multiple jurisdictions to maybe build interest among multiple legislators? So I think it's an interesting question, but I would answer it by saying both. I don't know if that's super helpful, but the more avenues you have for making your case and advocating is probably helpful.
Yeah, and just to follow up on that, I think that's ironically enough where our community fact sheets can be helpful to that ask, because when you have data from various districts across the state, you can compare how the impact of your project will be, who is affected by the projects. Maybe there are differing circumstances in different portions of the state that you can speak to how your project will respond to the unique needs in the of Ohioans in that particular portion of the district. You can also talk about the collective impact. So if there's individuals who might commute to that area, who might be impacted by your project, that's something you can also talk about on a regional level, how that could impact an entire region of the state as well. So I wouldn't necessarily tell you to do one or the other, but you can definitely find a way to get more granular if you want to focus on specific areas, but also look at a big picture and how the districts compare to each other.
Great. Another question. Sorry, we've got a couple that just popped up.
That's okay.
Is there any specific funding or special task force group at the state level that would address DEI issues, not necessarily related to COVID, but general public healthcare?
So Jamie Carmichael at the Ohio Department of Health is the Chief Health Opportunity Officer, I think is her title. And so she is focused specifically on, and not just related to COVID, but health across communities. So if you haven't talked with her and her team, I would reach out to Jamie Carmichael at ODH.
This is a really great question. Do you have to own the structure to make a capital improvement, or can you be a lessee guaranteed to stay for a certain length of time?
That can be a tricky question. And I'll answer it by saying this. When we get to the point of actually dispersing capital dollars, the state agency that is the fiscal agent for the project. So each project gets appropriated to a state agency, and then they're the fiscal agent and work with the community to actually effectuate the project. So the state agency that is the fiscal agent enters into a joint use agreement with the property owner for that capital project, and it lays out all of the terms. And again, some of those terms are specific to state bond funding. So I don't want to say that it would be impossible in a lease situation if it was a long term, but the owner of that property would need to be involved in that joint use agreement. So that it would need to be something that is, that all parties can agree to. And I will say that there are times when again, we have a project that's been appropriated in a capital budget, and it's time to kind of work with the agency and finalize those agreements, that if the requester was not totally familiar with kind of the way capital funding works, they sometimes are surprised by the terms of that agreement and can kind of balk at the terms at that point. And so that's sometimes why capital projects will get hung up at the agency process. So one thing, if you want to kind of get ahead of that and think about, you might want to go to the website of whatever agency might be your most likely fiscal agent, and get a copy of what their terms of their agreements are, and read through those, make sure that there's nothing disqualifying that you wouldn't be able to agree to, because again, those cooperative agreements are key to capital funding. There has to be a kind of a state interest and a state nexus in order for the state to supply our bond funds to a project.
Great. So we have a lot of questions that have popped up, but I know that we're starting to run low on time. But there is one that I think would be interesting to end with, because I'm interested to see what you think of this. Do you expect the influx of federal funding to impact this capital budget cycle? And if so, how
It very well could. There could be projects that end up in the capital bill itself that are funded through one of the federal funds. We didn't talk at all about federal infrastructure dollars, but the federal infrastructure bill that passed just a couple of months ago, most of those dollars haven't kind of been rolled out yet by the federal agencies. And so we're kind of still waiting on some of that. But, broadband was mentioned earlier. There are some broadband funds that were included in that infrastructure bill. And so if the timing's right, we could end up, I think, potentially appropriating some federal projects that have, a capital, that are kind of capital projects instead of bond funding, potentially federally funding. But I think it's really too early in the process to know that for sure. But having various resources available can affect the decision-making process. And, at this point in time, like I mentioned, the state budget is on really firm footing. Our ability to kind of be participants in the municipal bond market is very strong. Our bond rating as a state is, we have the highest bond rating and outlook that we've had as a state in more than 40 years. So the state of Ohio is in a very good position to be able to participate in capital funding. But if there are other sources available that are applicable to a particular project, then we always want to look at the widest scope available.
Great.
Sorry, Andrea.
Please.
I was just wondering if I can also just add two quick things. One is what's really interesting about the American Rescue Plan Act dollars is how it specifically calls out unserved and underserved communities. And so we look at the disparate impact of the pandemic and how it impacted different portions of the population. That's something that I think can be really interesting in terms of how those dollars are spent, how they respond to the needs of various communities across the state. And I also just wanted to say thank you to the director and to the Office of Budget Management, because they have been a phenomenal resource for information about the American Rescue Plan Act. It is something that I think everyone was kind of just drinking out of a fire hose a little bit in the first few months. And the director and her office did a phenomenal job. And I would really just want to salute her and also just encourage individuals, if they have more questions, the state is a great resource to get a lot of questions answered about that. So I just wanted to publicly acknowledge the director for all the work she did on that.
I'll just make one final point about the American Rescue Plan Act dollars too. I think it's important to remember of the total state and local recovery funds, half were appropriated to the state and then half were appropriated to local governments. So there are opportunities to approach, your counties, your cities, your municipalities, or if you have a local project that you think, would be beneficial and funded through ARPA dollars, the state is not your only avenue. Half of those dollars went direct from U.S. Treasury to our communities. So that's another avenue to keep in mind.
Thank you both so much. This has been extremely informative, and just really appreciate your perspective on all these questions that we're constantly kind of hearing out in the field, if as it were. And just thank you so much for your time. We will send out a follow-up email to all of you who logged on today with some of the links that were mentioned, the blogs that we'll mention, the director's OBM website links on capital budget eligibility. And we are here as a resource for any follow-ups as you consider what dollars to go after. So thank you so much, Director Murnieks. Thank you so much, Will. It has been really a pleasure and an honor to be with you today. So we look forward to the next one, hopefully maybe in person one of these days.
Let's hope.
Yeah, I hope
Thank
so.
you.
That'd be great.
Take care, everybody. Thank you so
All right.
much.
Thank you. See you now.